breakthroughs. We are going to be talking about what's new in hyperpigmentation in cosmeceuticals. People are already familiar with, a little bit about hyperpigmentation, so I kind of wanted to focus on some new updates in the literature as well as some new updates in the product market as well. So we can go ahead and get started. I am Radhika Shah, by the way, and I will hopefully, there we go. So I wanted to start out talking a little bit about myself so you can get a little background. I am at the new Westlake Dermatology location in Lockhart, Texas, so a little bit south of Austin. It is a new location. We opened up at the beginning of November, so if you weren't sure if it was open yet, it is. I am originally from Southwest Houston in Missouri City, Texas. I went to undergrad at Houston Baptist University in Houston, and then also did my master's at the UNT Health Science Center in Fort Worth. I then went on to Texas A&M for medical school, did my intern year of training at BUMC in Dallas, and then finished out my dermatology residency at Baylor Scott and White in Temple. So just hopped all over Texas. I wanted to mention that I have no financial disclosures or conflicts of interest. And then, of course, stay tuned for a special offer at the end. We all like special offers. So to understand what's new, I think just understanding a little bit about hyperpigmentation is important. So hyperpigmentation is actually increased melanin deposition in the skin. It is very common. A lot of people deal with it, and it can negatively impact the quality of life. So it really affects people's mental health. It is something that a lot of people deal with, may not be talked about as frequently, but I think it's one of those silent things that people deal with. The good thing is that treatment exists. So we'll talk more about that. So to understand hyperpigmentation, we have to understand what melanin is. And melanin is a natural pigment produced by melanocytes. And the melanin actually gives color to our hair, skin, and nails. The main function of melanin is to protect our skin or our hair and nails from harmful UV rays by actually absorbing them. There are two main types of melanin. There's eumelanin, which gives us our brown and black hues, and then pheomelanin, which gives us our red and yellow hues. So if you can imagine, in darker skin types, we have more eumelanin. In lighter skin types, we have more pheomelanin. So some common causes of hyperpigmentation that we see often in clinic, that a lot of people just out and about, that you will probably see these people deal with these things. On the top left is melasma. So usually this is like the patchy brown discoloration on the cheeks, on the upper lip. We also have post-inflammatory hyperpigmentation, like on the top right. This can be a result of acne, other inflammatory conditions. And then in the bottom middle, we have sun damage or sunspots. This commonly affects the sun-exposed areas. So you will see this a lot. Some less common causes, and don't be frightened by these photos. They are pretty rare. We don't see them often, but they can happen, and it's good to be aware of them. So on the top left, we have a type of condition called ashy dermatosis. It's got a fancy name as well. In the top middle, something called lichen planus pigmentosis. It's an inflammatory type of hyperpigmentation disorder. On the top right, we have post-inflammatory hyperpigmentation from lupus. And on the bottom, we have two different types of drug or medication-induced hyperpigmentation. The one on the left is from an antibiotic. The one in the middle is from actually a chemotherapy drug. So a little bit about melasma. This is most common in young and middle-aged women, but can also be seen in men. It's most commonly triggered by sun exposure, pregnancy, birth control pills, all of those hormonal things. It can involve all layers of the skin depending on the severity, and it can be aggravated by certain medications. In addition to treatment, the underlying causes definitely need to be investigated and managed appropriately. So if this means, you just have to be a little bit better about sun protection, discontinuing the birth control pills, or, a lot of times for pregnancy after women deliver, it usually improves. So those changes can help. A little bit about post-inflammatory hyperpigmentation, or PIH. It is very common, especially in darker skin types. This is due to excess melanin in the skin after inflammation or injury. It can occur anywhere on the skin, and it can appear dark brown, gray blue, or gray brown, depending on what layer of the skin the melanin is deposited. Another important aspect of managing this is treating the underlying inflammation. So if that's acne, getting the acne under control, insect bites, just, obviously trying to avoid scratching, psoriasis and eczema, treating those conditions, that can definitely help treat the inflammation and prevent hyperpigmentation. And then regarding sunspots and solar lentigines, so solar lentigines is just the fancy name for sunspots. This isn't a true disorder of hyperpigmentation, but it does involve possible increase in the melanocytes due to UV exposure, which then leads to increased melanin. And it's present in greater than 90% of Caucasians over the age of 60. So very, very common. I bet you could look around at the grocery store and you could see these sunspots everywhere. The color does range from tan to light brown to dark brown. And it's good to know that these are actually an independent risk factor for the development of melanoma, just because it means that you've had sun damage. So definitely good to get your skin looked at. So a little bit about my rules for hyperpigmentation. And if you've been my patient, I've said this to you before. If you're not and you've asked me about hyperpigmentation, I've told you these things. But number one is see a dermatologist. Proper evaluation and diagnosis leads to the best and safest outcomes and results time and time again. So definitely see a dermatologist. Number two is sunscreen, sunscreen, sunscreen. I cannot emphasize this enough. I tell all my patients this, that nothing matters, nothing in the whole skincare realm, nothing matters if you're not wearing sunscreen. So this is it's a very important part of it. Number three, be patient. Hyperpigmentation may never fully resolve, and I don't say that to scare you or, make you lose hope, but I just want to make sure I'm being realistic with you as well. It doesn't necessarily resolve, and it can take months to years to improve or fade. But we have seen some really, really great results. And that's why, obviously we're having this webinar. So you are aware of the available treatments. And then just another part of that is just consistency. Consistency is key. If we really want to see improvement, we have to be consistent. And then lastly, avoid using multiple products for hyperpigmentation all at once. Usually 1 to 2 is good to start with, just so you're not stressing your skin out or causing too much irritation with some of these active ingredients. I thought this infographic was really interesting. It's from an article published in the Journal of Drugs and Dermatology last year. And what I want to focus on is on the left side of the infographic. So A and C. The first question is, do you know what hyperpigmentation is? And all of these patients who were dealing with hyperpigmentation themselves answered, and there was a resounding yes. So people knew what hyperpigmentation was. But what I thought was really interesting was in C, they asked, are you currently seeing a dermatologist? And out of those patients dealing with hyperpigmentation, almost 80% said they were not seeing a dermatologist. So, kind of back to my rules, number one is seeing a dermatologist. I just don't think that everybody is aware of the things that we can prescribe and do and guide you on when it comes to hyperpigmentation. Every patient is different. So even if you talk to somebody who's dealing with it, is using a product, has had good results, doesn't mean that same product is going to work for you. So definitely important to see the expert, get some guidance, get some good tailored recommendations. So a little bit on, updates and research. I like to focus on the quality of life, and I don't think people talk about it enough when it comes to hyperpigmentation. But out of patients dealing with hyperpigmentation, one study found that almost 50% felt self-conscious and 33% felt less attractive, which is really disheartening. About 53% expressed embarrassment and 22% experienced a negative impact on their quality of life. And then another study found that some patients were actually willing to allocate up to 13.3% of their monthly income to address hyperpigmentation. And I think that just goes to show that people are really bothered by hyperpigmentation and are willing to do whatever it takes to address it. So, obviously we want to make sure that your resources are being used appropriately, whatever, money you are allocating towards treating or, going through procedures or things like that are actually going to be worth it for you. A little update on melasma. So melasma has always been regarded as a pigmentary disorder, but one study found that melasma may be inflammatory as well as pigmentary. They actually found that samples of affected skin have shown increased numbers of inflammatory cells, including, and sorry for being so sciencey, but I think it's important to talk about, but CD4 positive T cells, macrophages, and mast cells. They also found that visible light, not just UV, plays a central role in development, especially in darker skin types. And we'll talk about visible light in just a couple of slides. So all that being said, treatment for melasma should actually involve targeting pigmentation as well as inflammation. Some tried and true ingredients. So I got this list from a study. It was the Delphi consensus from dermatologists about recommended skincare products specifically for hyperpigmentation. So the consensus just means that pretty much all dermatologists recommend these specific ingredients. So hydroquinone is a bleaching agent, a commonly prescribed bleaching agent that has a lot of data to support it. Definitely, has good results. And I prescribe it all the time as well. It works really well. So it's definitely at the top of the list. Kojic acid, a little gentler, but also helps with hyperpigmentation. Topical retinoids, these are, our over-the-counter retinols, our prescription strength tretinoin, those kinds of things that can help with hyperpigmentation. Vitamin C, which is getting a lot of attention in, the media, social media. A lot of people starting to use vitamin C, which is an antioxidant, helps to brighten the skin, and it works really well with sunscreen. Azelaic acid is a good anti-inflammatory agent that helps with acne, helps with hyperpigmentation. Definitely would not use it alone for hyperpigmentation, but has really good data behind it. Glycolic acid is a chemical exfoliant. So we do a lot of in-office chemical peels with glycolic acid. It's available in a lot of over-the-counter skincare products in lower percentages. Definitely does a good job with hyperpigmentation. Then we have topical or oral tranexamic acid or TXA that's available, and then niacinamide, which is a very common ingredient that you'll see in a lot of skincare products. So tinted sunscreens, if you've talked to me about hyperpigmentation or you've been my patient, I have talked to you about tinted sunscreen. And why is this so important? So like I mentioned, we're going to talk a little bit about visible light. Visible light is actually the wavelength of light that humans can actually see or perceive. So if you think of like indoor or overhead lights, computer or phone screens, which we're all on all the time, lamps, all of those things are considered visible light. Why is this important? Well, studies have shown that visible light can induce persistent pigmentation, especially in those with darker skin types, and then redness in fairer skin types. So just by sitting here under my lamps, if I was dealing with hyperpigmentation and not protecting my skin, that could be getting worse just by, sitting here. Tinted sunscreens are special because they contain iron oxides. So not only does this give sunscreen a brown color, which can be good for coverage, but it also protects us against this visible light. And studies have shown that sunscreens with visible light protection can more often prevent relapses of melasma compared to sunscreens with only UV protection, which is a lot of what we see on the market. In addition, we see greater results in patients treated with the bleaching agent, hydroquinone, when using a tinted sunscreen along with it compared to just UV protective sunscreen. There are a lot of tinted sunscreens on the market these days. I would say probably within the last 5 years, this has really blown up. So, it can be difficult to choose, or, pick a tinted sunscreen that works. But on the next slide, I do have a few that I recommend. So kind of, listed in order of price point. On the far left, I listed a CeraVe hydrating mineral with a sheer tint sunscreen. Works really well. I would say it's a good starter product, reasonably priced, has good SPF, also has a sheer tint for people who don't want more of that coverage. It works really well. Then we have La Roche-Posay, higher SPF, Also, a tinted mineral sunscreen. La Roche-Posay is known for their sunscreens as well. Great product. Elta MD, probably my favorite sunscreen brand. They offer a variety of chemical, mineral, and hybrid tinted sunscreens. Then you have on the higher end of prices, we have Elastin and Isden as well that, can feel a little bit more elegant on the skin, and work also very well post-procedurally. So the first product that we're going to talk about for hyperpigmentation that's gained a lot of press over the last couple years is this Mela B3 Dark Spot Serum by La Roche-Posay. It contains a patented ingredient called Melasil, as well as 10% niacinamide. This is best for sunspots, post-acne marks like we saw in the photo, and discoloration in general. And what is cool about it is that its mechanism is unique compared to a lot of the other dark spot correctors on the market. So rather than inhibiting tyrosinase, which is an enzyme involved in the production of melanin, Melasil binds to melanin precursors. So what's cool about this is that when it binds to the precursors, you're basically stopping hyperpigmentation from actually occurring in certain cases. So if you are dealing with acne or certain, inflammatory skin conditions, if you're concurrently using something like this, you could potentially prevent the hyperpigmentation from happening because it's binding those precursors. The other good thing about this is that because it's using a different mechanism, you maintain the integrity of the melanin producing cells, so the melanocytes. This is important because some of the dark spot serums or dark spot products, hyperpigmentation products, those act on the melanocyte, and that can sometimes have a toxic effect on the melanocyte, leading to certain side effects, irritation, sometimes permanent hyperpigmentation. So the mechanism of this one is really cool, and that's why I think it's such a novel product. The good thing also is that it's safe for all skin types. So this is a little graph from one of their studies. They looked at something called the mean darkness intensity score. So if you want to just think of that as darkness, I think that makes it a little bit easier to understand. But as you see in the graph, we start at day 0 and go up to day 84. And as you see, the bars are getting lower. That means that the darkness is improving. So they actually found a 25% change in darkness average in all of the patients, about 32 patients in the study. And 27 reported improvement. 5% just, or 5 patients reported unchanged, hyperpigmentation. But that's pretty impressive, 84% over 84 days. So if you think about that, that's not really long. That's almost 3 months. And a lot of times, whenever I see patients, I try to set expectations. I'm like, hey, give it a few months. It may take several months. So usually I'm saying, at 3 to 4 months, we'll maybe see improvement. So the fact that they were able to see improvement at just day 84 was really, really impressive. This is from that same study, just, obviously photographic evidence. So same thing, day 0 to day 84. These are 2 different patients, one patient at the top, another patient at the bottom. What I really like about these photos, and I am really picky about photos from studies just because I need to know that we're comparing the same person. It's not edited. But as you can see from day 0 to day 84, the hyperpigmentation isn't just gone. It's still there, but it has faded. And I think it's a significant improvement in the fading of the hyperpigmentation, which, is really impressive. I think that this is exactly what I mean in terms of it may never fully resolve, but we can definitely get it to getting better. So at day 84, almost 3 months, if this kind of improvement is possible, then why not? So we've got some really great products on the market. How do you use it? So pretty simple, just apply a few drops, about 3 to 4 drops on the affected areas of hyperpigmentation up to twice a day after cleansing. So you really want to cleanse the face so that way the serum is able to do its job. Of course, avoid using it around the eyes just because that skin tends to be a little bit more sensitive. And you can actually pair it with the Mela B3 cleanser and the Mela B3 sunscreen. La Roche, came out with just a Mela B3 line. Of course, the sunscreen is not tinted, but it does have the Melasil in it. So if you want something just to kind of reapply throughout the day without having to apply your tinted sunscreen multiple times a day, this could be an option. It's good to use, concurrently with a tinted sunscreen. So definitely a good option. Now, the next product I wanted to talk about is this Eucerin Radiant Tone Serum. What's exciting about this is because it's available now in the States. It contains a patented ingredient called thiamidol, which is patented by Eucerin, which was only available actually in the UK, I believe, up until recently. So this is big for us here in the States. The serum also contains hyaluronic acid and this licorice root extract. It's great for persistent dark spots, especially from melasma or sun damage. This patented ingredient thiamidol is actually a tyrosinase inhibitor, like we had previously touched on. But what makes this tyrosinase inhibitor different is that it's more specific for the human tyrosinase enzyme. So it's actually shown promising efficacy in the treatment of melasma compared to hydroquinone. So hydroquinone is our tried and true bleaching agent, and the studies have shown the Eucerin Radiant Tone with the thiamidol head to head with hydroquinone, showing similar and even sometimes better results. So it's huge, obviously, because, it's an over-the-counter product, may not have the same side effects. It's not as cytotoxic like hydroquinone can sometimes be to those melanocytes just because of its specificity for this enzyme. From the studies, 98% of subjects reported the serum visibly improved their complexion after just 4 weeks. 4 weeks is impressive, y'all. Like, I feel like I, struggle with hyperpigmentation after acne, and I feel like my spots are still there 4 weeks later. But the fact that patients reported that, they noticed improvement after 4 weeks, like, this isn't an expert rating them. This is like, ourselves, and we're of course really hypercritical of ourselves. The fact that almost 100% experienced improvement, that's, I feel like, a big deal. So definitely good data out there to support this product. And again, safe for all skin types. So we've got good things out there. So this is a photo before and after from the study. So we have the baseline photo on the left, and then on the right, we have a photo after 8 weeks of regular use with the serum. I will say that in the study, and with this patient specifically, they were also using the Radiant Tone sunscreen along with it. So it could be just an added benefit as well with the two separate products. How to use it, same kind of deal, apply just a thin layer. It comes out as more of like it's in a pump rather than a dropper bottle. So just a thin layer on the affected areas up to twice daily after cleansing. And of course, avoid using it around the eyes. And then you want to pair it with a cleanser and a sunscreen in the same line if you want like the more targeted results that Radiant Tone is trying to give you. So the cleanser, I will mention, does not have the thiamidol in it, but the sunscreen does, and that's what was used in the study. So Radiant Tone or Eucerin, they actually have a line of more products. They have an eye cream. They have that, obviously, the cleansing gel. They have the sunscreen, the morning moisturizer sunscreen, and then they also have the night cream. So you could basically have your whole regimen all in one. So when should you see a dermatologist? And my answer is when you first notice hyperpigmentation. And, the reason why is that, we already touched on this, but early diagnosis can help determine the best treatment for you, including prescriptions, while your hyperpigmentation is in the early stages. Proper evaluation, of course, can also help rule out other less common causes of hyperpigmentation, which you might be just chalking up to, oh, it's probably just sun damage. Oh, it might just be melasma. But there are a lot of inflammatory pigmentary disorders that definitely may require more aggressive treatment. So always good to get evaluated. And even if you don't require prescription management, we can create a tailored over-the-counter regimen depending on your specific skin needs to get the best results. Some patients have more sensitive skin. Some, we deal with a lot of different skin types, like in terms of how fair or how dark skin you are. So different products are meant for different people. Certain ingredients might be more irritating to certain people. So it's always good to get the guidance of a dermatologist. So regarding prescription management, just so you know what's out there, what do we actually prescribe for this? So my favorite thing to prescribe for hyperpigmentation is a triple lightening cream or other compounded lightening cream. And usually this is a combination of hydroquinone, that bleaching agent. It's available in a variety of percentages, about 4 to 12%. But the combo cream also contains a mild topical steroid to help with any irritation from the hydroquinone itself, and also can help with, the inflammation that may be causing your melasma. And then also in the compound cream is a topical retinoid like tretinoin. And that addresses hyperpigmentation as well, increases skin cell turnover. So you kind of get all three good things in one product. These compounded creams can also contain kojic acid as well as topical tranexamic acid. Azelaic acid is another thing that I prescribe. So over the counter, you're really going to only see 10% or less. We really start to see improvement with azelaic acid at the 15 to 20% range. So this is available as a prescription. And the bonus here is that it's safe for pregnancy, which not a lot of products are. And then oral tranexamic acid, I don't prescribe this as often just because you have to find the right patient, make sure they don't have any pre-existing medical conditions that would preclude them from being on this medication, just because there are some side effects that we have to talk about. But it's an option for patients who don't want to apply a topical or have tried topicals, they don't tolerate it, or it just hasn't worked for them. Some in-office procedures that are available for hyperpigmentation. My favorite is superficial chemical peels. Glycolic acid and Jesner's are a couple of peels that we offer to address hyperpigmentation. And usually not, a lot of people will think, oh, one and done, like it didn't do anything. Usually a series of peels is required. So sometimes we can increase the percentage of the peels depending on how you do after the first one. But I would say around 3 to 6 peels is required for meaningful improvement. And usually these are performed about 1 month apart to make sure your skin is healed. Other things, there's IPL or intense pulse light, which is also called a photofacial. This is really good for patients who have sun damage. They kind of have that reddish, brownish hyperpigmentation on their face. So this works really well for that. And then we have fractionated lasers. And within Westlake, there are lasers like Ultra Clear and LaserMD that work really well for hyperpigmentation. And that's it as far as my presentation goes. These are just some of my references that I used to create this. And of course, I know the moment that everybody was waiting for is the bonus offer. So basically, you can get a complimentary tinted sunscreen of your choice, valued up to $75 with your purchase of a glycolic acid peel series, which is a total of 3 treatments to be performed by me. So what we have available as far as tinted sunscreens go, we have the Elta MD UV AOX Elements. This is a chemical-based tinted sunscreen at SPF 50. Then we have our UV Restore SPF 40, which is a mineral, 100% mineral tinted sunscreen. So patients who have maybe more sensitive skin, this is better tolerated. Then we have the Isden Airphotona Ageless tinted sunscreen, as well as the Elastin tinted sunscreen. So basically, the way you would redeem this offer, you should, if you attended this webinar, you should be getting an email sometime within the next day, either tonight, tomorrow morning, regarding the offer. So the details will be in there. Of course, you can book online. You can call our office to book an appointment. Online, typically, I would recommend just booking a new patient visit, just an office visit, just so we can talk about different options. If skincare is better suited for you, if you wanted to go ahead and book that glycolic acid series, or if you wanted to talk more about prescription products that we offer, those can all be addressed during the office visit. This offer is good for a year, so you have some time. If you had any questions about anything, you can always call our office. Of course, this is the Lockhart location. Can be a little bit tricky because we opened just a couple months ago, but if you book online or just give our office a call, we can guide you in the right direction. All right. And then I wanted to open the floor up for questions. I'm going to go ahead and stop sharing. And if you wanted to type your questions in the Q&A box, I'm not sure. I think we have one question. So there's a question that says, for people who feel frustrated or discouraged by slow results, what mindset should they have? So it's a tough subject and tough question to answer, just because I'm meeting different people at different stages in their mindset, like people who have just now started dealing with hyperpigmentation, people who have been dealing with hyperpigmentation their whole life. And I've heard well, I never had any skin problems. What do I do? How can I deal with this new change in my skin? Or I'm just so fed up with all of these things, that I've tried over the last 10 years and nothing seems to help. So what I like to do is just kind of level with my patient and say, look, obviously you've tried a lot of things. Obviously you had previously great skin and now you're dealing with this. The number one thing, and if you go back to my rules, the number one thing is seeing a dermatologist. A lot of people don't make it to that point. A lot of people aren't guided in that direction. They don't know that that's an option. I will say, growing up, I feel like dermatology wasn't like a known thing. I feel like if you had like really bad acne, maybe you knew to see a dermatologist, but seeing a dermatologist is not something that a lot of people are used to doing. So in terms of mindset, I will say, I like to give my patients credit where it's due. I like to say, look, you have come to see me. We have options. The good thing is we have options, especially over the last, decade, 2 decades. There's been a lot of advances in technology and skincare ingredients, and just the skincare realm. And so we have a lot of options that are going to be suited for a lot of different skin types. So, just trying to at least level with my patients and saying, hey, look, you're doing a good thing. You're here. You've already started the process. You've already done a majority of the work by being here. Now it's just a matter of, checking off some boxes, but, just staying hopeful, because I assure you that you have not tried everything that there is available. There is a lot of stuff available, and maybe you just tried the wrong things, but that's why, I wanted to at least educate you all today, so that you are already starting, ahead of yourself, like 30 minutes ago. So, just try to stay hopeful. I'm here to help you. I'm here to level with you. And I am somebody who likes to be honest with you. If I feel like, on the first visit, like, okay, we're not going to get complete clearance, but we can see improvement, I will let you know. And I'm not going to sugarcoat it. I'm not going to, make these false promises, because I wish I had the magic tool. But the good thing is we have resources. We have these new products on the market, and we can definitely get some help. Next question is, how can everyday people avoid being misled by skincare marketing and know what actually works? This is hard because, everybody's on social media. Everybody is talking whenever people hang out, they're, like, oh, what'd you do with your skin? Like, it looks great. So people just naturally talk about what they're doing for their own skin. I will say, like I said, when you should see a dermatologist is when you first notice hyperpigmentation. So, I will say that even though we talked about these products today and I recommend them, I will say that if you have questions, if you're like, I just want to make sure this is good for me, come see me, or go see a dermatologist, just because it may not be right for you. Maybe you've already tried that product and it didn't sit well with your skin. So, I will say that it's easy to get caught up in social media because everybody is recommending things. But I will say a lot of people are getting paid to promote certain products. So please, please, please do not fall for, viral products. Please do not fall for viral marketing. Trust your gut, see a dermatologist. We will definitely guide you in the right direction, depending on what's best for you, and go from there. Next question is, can we receive a copy of your presentation? So it will be uploaded on YouTube. I'm not sure how long, it'll probably in the next week or two, it'll be on YouTube. So if you look at Westlake Dermatology's YouTube account, it'll be uploaded there. For the next question, we have, in creating a regimen, will the products you showcase play nicely with peptide serums and or certain forms of vitamin C? So I will say peptide serums are really great. I feel like a lot of them are pretty well tolerated, no matter your specific skin type. And I think peptide serums are great because that is something that is becoming more viral and it has a lot of good data to support it. So yes, a lot of the hyperpigmentation products should play nicely with these peptide serums, but I always say, introduce one product at a time. Don't start 5 different things all at once because then you're not sure if your skin reacts, what your skin was reacting to. So always start slow, try one product at a time, maybe patch test your skin to see if you're gonna, tolerate it okay. As far as vitamin C goes, that tends to be a little bit trickier because vitamin C, not all vitamin Cs are the same. There are some that are formulated differently and can be a little bit more irritating to certain skin types. So for vitamin C, I would be extra careful. So definitely patch test your skin, definitely introduce a vitamin C, slowly, or introduce this hyperpigmentation product slowly into your regimen just to make sure it's not going to cause much irritation, because that would be the primary thing to worry about, is just irritation. Do the glycolic peels dry the skin? And how often are peels recommended for someone over 60? So the good thing is that there are no rules on how much you can do. So glycolic acid peels in the moment, so after the peel, it can make your skin feel a little bit gritty, a little bit dry, but that's just the glycolic acid peel doing its job. It's exfoliating the skin. So it's natural to have that texture on the skin. Usually in a week or two, it will resolve. And actually the skin that's, fresh, or, after the peel, it tends to be a little bit more hydrated and a little bit softer too. So you shouldn't experience consistent or persistent dryness after the glycolic acid peels. If you're reacting to it and it's too irritating to your skin, then you may be dealing with a little bit more persistent irritation, maybe an irritant dermatitis that could be contributing to persistent dryness. But another thing to talk to your dermatologist about. And after 60, 60 is also variable. One person 60 may not be another person 60. And so I will say that glycolic acid peels, because they're superficial, are pretty well tolerated by all age groups. I would say really just the 1 month apart. So, you don't want to do it too soon. I like to do a lot of the chemical peels in the winter months, just because in terms of downtime, you're not going to deal with as much sun exposure, post-inflammatory hyperpigmentation risks if you're not protecting your skin from the sun. So just a month apart. Do all locations help with the issue of hyperpigmentation? So yes, as long as there is a dermatologist or a dermatology PA or NP or somebody who, can see you for an office visit, most locations, can address your hyperpigmentation. So, obviously whatever's convenient for you, but, if you're ever unsure, always call the office. The office staff should be able to guide you in the right direction in terms of which providers, can address certain issues. And so yeah, all locations will. Then can lifestyle really change skin, or is it mostly genetics? So that's also a hard thing to answer. I will say genetics plays a huge role in how we age, how susceptible we are to sun damage or just aging due to sun damage. Unfortunately, we have no control over that, but lifestyle can help. So if you're more prone to, developing, sunspots, things like that, because of your genetics, then that means that you try extra hard to protect your skin from the sun, things like that. It's the same way I, talk to patients about diabetes or high blood pressure. Like if your genetics is prone to developing diabetes or heart disease or high blood pressure, then you have to take those extra measures to, follow a healthy lifestyle, healthy diet, to really mitigate that risk and mitigate that, susceptibility to developing that. So, things like smoking can really, really negatively impact the quality of your skin. Not protecting your skin from the sun, even if you don't burn. Like a lot of people think that, oh, I don't burn, so I don't need to wear sunscreen. Anytime your skin tans, that's your skin screaming for help. So everybody, if you're going to be out in the sun, needs to wear sunscreen. So lifestyle can really contribute to the quality of our skin despite genetics. Does insurance cover some of the meds? Yes. So I will say, like, if we are prescribing something like tretinoin, a lot of times it is considered, cosmetic, but, certain insurances will cover that. As like acid, sometimes we'll try to prescribe it to your local pharmacy through insurance. Sometimes they'll cover it. I haven't had great luck with that, but usually the compounding creams we will prescribe to a compounding pharmacy, which those compounding pharmacies are usually cash only. They don't take insurance. So, but it really just depends on what your specific need is. Tranexamic acid can, sometimes be covered by insurance. So it really just depends on your specific insurance plan. I don't get to know a lot about the back end of things, like after I prescribe it, how much patients end up paying for it. Unfortunately, I don't have a lot of data to answer that fully, but sometimes insurance can. What advice would you give to someone just starting to care about their skin? I will say, start slow. It is easy to get caught up in like 10-step skincare routines. It's easy to get caught up in things that are really, really expensive that don't actually help. Like I said, there's a lot of marketing out there because a lot of people on social media are getting paid a lot of money to promote these products. So, my advice would be start small. When I tell patients about skincare, like I said earlier in my presentation, sunscreen is the single most important thing that you can do for your skin. So if you're not doing sunscreen, don't even think about anything else. So definitely start to wear sunscreen. And then, basics are cleansing once a day. Some people have to do it twice a day. Not everybody has to cleanse twice a day. Usually using a gentle cleanser is best. Moisturizing our skin if we're, dry skin prone, and then of course, sunscreen. If you wanted to get more into, addressing specific things like aging, hyperpigmentation, brightening of the skin, then I usually will say to patients that the two most important things that I recommend are usually vitamin C, retinol product. But outside of that, it's really just dependent on your specific skin concerns. But I would really start slow and keep it really, really simple. Did I hear that there is a Westlake Dermatology location in Lockhart, Texas? You sure did. So we opened, I think our first, it was on November 10th. So we are right there. If anybody is familiar with Lockhart, we are located conveniently on the square, right on East Market Street. So come see us. We have actually this background of mine is actually our hallway. So we have a very pretty clinic. I feel very lucky to work in such a beautiful location and lucky to work with the people of Lockhart. Okay, we have a few more questions, so I'll try to get through these pretty quickly. Somebody said, what part of your job is most emotionally rewarding? That's tough. That's a loaded question because I feel like so many different parts are really rewarding in what I do. And I think somebody actually earlier today asked me why I chose dermatology. What I love is that there is such a huge overlap of mental health, psychiatric things with dermatology. And I feel like the two just coincide so much. And when I treat my patients, I'm treating my patients as a whole. I'm connecting with them. I'm really getting down to the nitty gritty in terms of, okay, well, why aren't we able to be consistent? Why is this bothering us so much? Really trying to address the root cause of the problem. And when we formulate a plan, just a joint plan between me and the patient, I feel like, we build a relationship that's long lasting. We build a lot of trust, and I feel like finding somebody who truly cares about your skin, cares about your outcome, really cares about what's going to be safe for them without just treating them as a number is really important, especially with something as, hard to deal with as hyperpigmentation. Like I said, a lot of patients are really embarrassed by it. They're not willing to talk about it. A lot of patients are hiding under makeup. They don't go out. They don't go to social gatherings because they're dealing with hyperpigmentation. So being able to give patients confidence is probably the most emotionally rewarding part of what I do. What do you hope patients feel after leaving your office, regardless of the outcome of their treatment? Just like I said, kind of goes hand in hand with what I just answered, but just making sure that they feel heard, that they feel safe in trusting me with their skin, that they've found a place where they feel like there's at least hope. And I find that when I, see these patients, a lot of the patients don't actually expect 100% improvement. A lot of patients don't expect a magic cure. They really just want to feel heard. They want to feel seen. They want to feel validated that what they're dealing with is hard. And they want to know that, hey, whoever I'm seeing actually cares about my skin. They're actually taking the steps to address the root cause of it and not just, throw things at me. How do you suggest doing a patch test? So I would say if you're trying a new skincare product, just take a little bit on your fingertip, and I would actually test out on your arm, on your leg. I wouldn't test it out on your face. So just do a thin layer, probably about maybe like an inch patch on your skin, and just let it sit for like a couple hours. And if you're not reacting within a couple hours, then you should be fine to use it on your face. Can those products you described be successfully used with ashy dermatosis? So that was one of the less common causes of hyperpigmentation. And yes, these products can definitely be used. It's definitely something that especially the prescription products, I will say maybe some of the over-the-counters are not as helpful just because the products are not as strong. But the prescription products are definitely really helpful. And then also glycolic acid or other superficial chemical peels can be really helpful to address those conditions. And most people think you can only peel the face. You can peel other parts of the body. Glycolic acid is great for a lot of parts of the body. So yes. How soon after a 3 treatment of a chemical peel can a patient start glycolic peels for maintenance? I would say, a month. There's really not a whole lot of rules when it comes to, maintenance versus active treatment with the glycolic acid peels. So, if you wanted to do a maintenance, I would say like 3 treatments you can do, then you can wait a couple months and, do another one. If you wanted to wait like 6 months to do another maintenance, you could do that. It really just depends on how severe your hyperpigmentation is. All right. Any reason to not use certain products if you've had a facelift? So I would say, it's really patient dependent. Facelifts can definitely cause some irritation of the skin, especially in the healing stages. You can have scarring from facelifts as well, which can make your skin overall a little bit more sensitive. So, I would say that, higher percentage of hydroquinone may not be a great idea just because that can be really irritating to the skin. But, it really is patient dependent. But I would just, like I said, just test it out on your skin, do a little patch test, see a dermatologist. We can kind of guide you in the right direction depending on what your specific skin type is. How do brands like Eucerin compare to other clinical skincare brands like Skin Better Science, Trinity, Cosmeceuticals? Is the quality better with the more expensive product lines? So that's a great question. I will say that all of these brands are great. They're all at different price points. Not one is necessarily better than the other. Certain products are, supported by more data clinically. There's a lot of, vignettes, like patient vignettes, or, if you talk to friends who use certain skincare products who will swear by certain things. I will say that, if you're trying to be a little bit more elevated in your skincare, it tends to be more in those higher, price brands like Skin Better Science, Cosmeceuticals, just because they are definitely the leaders in cosmeceuticals, specifically Eucerin, CeraVe, La Roche-Posay. They are like the foundational skincare companies. They are the ones that dermatologists recommend through and through, just because they understand skin really well. They understand sensitive skin. They understand all different skin types. So, especially what's great about their products is that they are at more affordable price points. And so they do have products that can address certain things, like they have the tinted sunscreens, they have vitamin C products a lot of the time. And so, I will say that depending on your price points, you're still going to get a great product if you go through one of those skincare companies versus the higher priced items. But Cosmeceuticals, like their vitamin C is like the gold standard for vitamin C products, just because there's so much data behind it. It contains other ingredients in it that can be really beneficial for skin. So it's not about quality. All of those products are great. It's just more about what the data is, what the price point is, what your specific needs are. Is there a specific, I think this is our last question, but is there a specific brand of cleanser that I recommend? So whenever I am recommending a cleanser, if I'm just recommending a gentle cleanser without any active ingredients, like if you're not dealing with acne or rosacea or, whatever it is, I always say Cetaphil and CeraVe. You can't go wrong with those products. And over the last few years, they've developed different varieties of cleansers that are also gentle, safe for eczema prone skin, safe for irritation, safe for using while you're using these other active skincare ingredients. So I feel like those are always my go-to for gentle cleansers. Vanicream is another one, especially if you're prone to like skin allergies or eczema. I feel like I'm always recommending those specific ones. But, honestly, there's so much out there. Some people will say one's better than the other. I swear by this. Everybody's different. And I think if you're going to a dermatology recommended skincare brand, then you're going to be in good hands regardless. So, yeah. So, if you ever have any questions, just ask your derm. But I think that's it for questions. So thank you all again for joining me this evening. Thank you all for these very insightful questions. I think these are really important things to talk about. And I'm happy that we were able to open up this discussion about hyperpigmentation and why it's so important to talk about and why it's so important for those patients to be seen. So if this is something that you're dealing with, if you know somebody that's dealing with it, definitely recommend them to come see me. Of course, I'm at the Lockhart location, but we have a lot of different locations within Westlake, depending on where you live. So really, really strongly recommend seeing a dermatologist. And remember, always wear your sunscreen. And just look out for that email. Like I said, you should be getting that email sometime within the next day regarding that bonus offer. And then, usually if you just put that bonus, if you mention that in your appointment notes when you book online, or you just let them know on the phone when you call in, they should be able to honor that offer for you. Alrighty. Well, thank you all for joining me, and I appreciate your support and your time this evening, and have a wonderful rest of the evening, and please be safe out there this weekend with the cold weather. All right. Thank you.